Everybody had great things to say about you. Everybody said you were super kind. You never yelled. You weren't an egoist. You don't throw instruments at people in the OR. I mean, that happens. Like I've heard stories about.
Many surgeons do. Welcome to the ALFI Podcast with none other than Aaron Lewis.
What's going on, Dr. ALFI?
What's going on? Welcome to the studio.
I appreciate it.
You don't want to miss this if you're interested at all in jaw surgery, because Aaron underwent jaw surgery almost a year and a half ago.
Yep.
And he's going to talk about the good, the bad, the ugly, and everything you need to know about his journey, recovery process. And I'm interested to learn a lot about the details.
Yeah, no, for sure. I would say that the surgery, I think there's only good to it. I wouldn't say there's really much bad to it. It's a little bit ugly because you look a little ugly once you're getting the surgery done. But I really can't say there's much bad to the surgery. So, but yeah, let's dive on into it.
Yeah, definitely. It's been fun seeing you. The entire transformation. Yeah. Obviously, pre-surgery, you were very excited about going into this, and we'll talk about that. And then really an amazing transformation, and to see you today with such good form and function, and can't wait to hear all the nitty gritty. But let's start from the beginning.
Yeah.
What was for the audience there, what were you dealing with as a kid? What was your bite like? What symptoms were you having? You've been through orthodontics, I'm sure, when you were younger.
So as of this taping, I'm 39 years old. Okay. And if you guys think I look really young for my age, that's thanks to Dr. ALFI doing such a great job on this surgery, right? But yeah, I mean, I was in orthodontics, or I was working with an orthodontist since I was 5 years old.
Yeah.
My mom would count. Retainers, spreaders, and 2 times in braces for multiple years.
So a big part of your childhood.
Yeah. And then most of my childhood.
Yeah.
Right. And then goodness, right when I was seeing you, I was wearing a night guard every night since I was 17 to sleep in because I was grinding my teeth so badly.
Yeah.
And it was very, very worn down and multiple times.
Was sleep an issue when you were younger? Do you remember it being something that you noticed, being tired, or any behavioral or issues or concentration issues in school? So
yeah, I mean, I have ADHD, definitely have ADHD. So concentration was always a really big issue for me, paying attention and focusing. For sure, that was an issue for me. I would say that, as other physicians would say, they'd say they felt like I slept but didn't sleep well.
Yep.
And not trying to jump too far ahead, but even looking at how I slept before and sleeping now, even with sleeping aids, you take a sleeping aid to sleep, it'll help you stay asleep, but you don't really get that full REM. And
right.
I sleep a little too well now, comparatively to my baseline of what I was at before.
Yeah, and we'll get into that. I'm excited. So when was surgery first suggested to you? And it was for an underbite.
Yes. Yeah, I had to kind of give. Some of the audience may get this, others won't, but I had a bad underbite, and then it would cause a gap at the top when I was a kid. And so when I first started, because I had gone and seen the orthodontist, I had a permanent retainer on the top teeth to hold the two top together. And then I was wearing the night guard at night. So that was my Band-Aid that I was using to keep my teeth straight. But to kind of give you a reference, I had the Jay Leno jaw with the David Letterman split.
That's good.
Yeah.
That's good. That's what makes you good for the camera.
Yeah, right. That's what makes it good for the camera.
Night. What time is it? We're almost prime time.
Yeah, we're prime time circuit right now. But yeah, for the parents out there, I guess with their kids, I'll give you a reference of how I looked as a kid with before all this stuff started.
And what was your main driver? Was it a bad bite? Were you having discomfort? Was it a aesthetic thing?
There's a lot that I know now that I was suffering from that I didn't really know, should I say, that I was suffering from. Yeah. The thing that I had always kind of felt like is if you looked at my preoperative pictures, there was a skew on my face where it went to the side.
Yeah.
And I always kind of felt like, and every time I would go to a dentist, it didn't matter who the dentist was, they'd always make some sort of comment. Oh, that's quite the bite you got there. And I'm like, okay, well, great. I feel insecure. Like, not only are you trying to sell me on whatever, now you're making me feel insecure about my bite,
Right.
you know, but it was always like,
it all out.
and nobody knew how to fix it. Like, it was just like, well, you've got this issue. Like, oh, that sucks.
Yeah.
You know what I mean? So I kind of always felt like there was something wrong with me. And I know now, I didn't know then, but it would take me forever to eat. It was really hard to eat. And again, I don't want to jump too far ahead, but I'll never forget when you pointed out, I was like, oh, do I need braces? And you're like, yeah. And I mean, we did Invisalign, right?
Right.
But when you pointed out my teeth were sideways, I was like, oh God, I didn't realize, this was the case. So that was, it would explain why I had such a hard time chewing and eating, and it was so inefficient. I mean, if I ate anywhere, I'd have to drink like 6 glasses of water to be able to get everything soft enough to swallow it down.
That's interesting.
So, yeah.
Yeah, and we'll put up your preoperative x-ray.
Yeah.
I mean, even if the angulation,
even if you look pictures of me smiling,
you can see it.
You could see it. I didn't see it before, and I'm like, why didn't no one say anything to me?
Right.
Or why didn't no one explain? I wish dentists, like for any dentists who are watching this, I think you really need to take an effort to explain to your patients what it means, because it may come naturally to you, but we don't understand that. When you make a comment like, oh, that's your bite or whatever, like you really need to go into detail to explain it to us and not just list it as an issue.
Yeah, it's good advice. I think it's easy for dentists and doctors to take things like that for granted sometimes, because things that are part of our vocabulary or we see every day.
Right.
People don't talk about these things.
No, they don't.
Every day.
They don't.
You're probably not aware of what we're talking about. So that is good advice. If you guys want to see the before and after pictures, you gotta keep watching.
Yeah,
we're not
sure. Keep
we're
watching.
not throwing that up yet.
Keep watching. Well, and I'll give you guys some pictures that really show my smile before, that shows kind of how they were slanted in.
That'll be good. Yeah, send those over.
Crazy.
Yeah. So what are these other symptoms you're talking about that you're aware now that you weren't aware beforehand?
I could breathe out of my nose. So before I ever met you, I'd had 2 deviated septum surgeries.
Yeah.
And I was going for potentially looking to have my 3rd, because the septum started deviating again. And I'll let you talk to why that happens. I was being told that I needed to get my tonsils removed, and I didn't have any real infection type of issues, but I was snoring. And it's not the best feeling to be, especially as a single guy, being told you snore.
Yeah.
I mean, I don't think anybody wants to hear that, but as a single guy, dating, being a snorer, was kind of felt bad. Like I said, eating was a pain. Other symptoms, I just felt, I'm a business owner, and I know you in a way are a business owner too, running a practice, and everything. You have to have a lot of drive, and it takes a lot of energy, and
definitely,
it takes a lot. But
yeah, before you say that, there's a great clip from Dana White where he talks about people say that they want to own their own business so they can, dictate their schedule.
Yeah,
and dictate when you can turn it off and on, and that is not what happens when you own a business.
That's not it at all. It's I think Mark Cuban says an entrepreneur works 80 hours to avoid working 40. Right.
Yeah.
We work aggressive hours doing what we do for a living, and we do it happily. We do it, and you're like, oh, I'm tired, but there's more of a deep, like, you wake up tired.
Yeah.
And you've gotten 8 to 9 hours of sleep.
Yeah, it just never feel rested.
You never feel rested. And it's not like, oh, my body's tired or whatever. So I'd say I sleep too well now. Like I know what it's truly like to feel rested.
Yeah. You jump out of bed?
I'm not a bed. Like I said, my muscles are a little sore, but I'm very well rested now, and that's what's
great.
nice. I actually feel like I've gotten a good night's rest when I sleep.
Has that translated to productivity?
For sure. I mean, I think it translated a lot more into what I've been able to do physically. I have a lot more physical energy, and I was lifting weights really aggressively. I was able to make more gains back in the gym, because that was always a concern with me. Getting the surgery, how long would it take me out of commission,
right,
or whatever. It's helped me with focus a lot. I've been able to focus better. It's been able to help me kind of control. I think sometimes I would say that it's not something you really want to admit to, but I'd say I was a little bit of a hothead for a long time. I had a very short fuse, very, 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 very irritable. And so I would say that the fact that you know, when people say that whole expression, take a deep breath, you know, I could take a deep breath now and really get a full breath of air. And I feel a lot more, I tell everybody I'm a lot more chill, a lot more calm.
That's awesome.
Than I used to be before I had the surgery.
Yeah. It's amazing how often I hear that from patients and when they come with a partner. It's
I
like
just breathe now, you know, but
it's like a common thing. And just, I mean, we know that you get a bad night's sleep, you're irritable the next day.
Well, for sure. But I think that even working in the stresses of, you know, everyday pressure, running a business and just working like I do for a living, you know, you have employee matters, whatever it may be that comes up, your breathing may get accelerated. And if you've got a restricted airway, like I had, you're going to get more exasperated a lot quicker. Yeah. And so you will react in ways that aren't really the best way to react. Yeah. And so you have to, then after some time you realize, okay, relax. It's okay. You can relax. Yeah. It's not that big a deal. And then your fuse is longer too. It makes life a lot better.
That's awesome. Is this something that you notice or people have pointed out to you?
I've noticed, like, you know, someone like, hey, really chill, like, you know. So I mean, I've noticed that. Yeah, it's been mutual.
That's awesome.
People around me. Yeah,
that's awesome. We talked about, so you did the surgery. You were 37 or 38 at the time.
So goodness, I first met with you when I was 37. Had the surgery at 38, and I'm 39 now.
Yeah, awesome. So what happened between high school and 37 before presenting for this operation?
I mean, nothing happened. That's what I mean. I was just living with a problem. Yeah. You know, just something that I constantly had to hear every time you go to the dentist. Oh, you know, the thing that made me kind of, you know, when you go down that road, it gets me kind of resentful all these years is that everybody tried to present let's find an orthodontist. And they'd say, oh, I think we could fix that. But you knew from whatever they're saying, they were just giving you a Band-Aid to a problem. It wasn't a real fix to it. And so
you were aware of that.
I could just tell.
You could tell.
I've been down that road. I've been down that road too many times where you'd meet with an orthodontist or a dentist, and they'd say, "Yeah, I think we got this," or even before, you know, because I had my wisdom teeth out at 17, and I'll never forget the conversation. My dad had asked the guy that did my wisdom teeth, great man. I think he's passed on since then. But he said, "Well, I think we could do it. We could take a look at that about doing the jaw surgery back when." And those just, you know, it's just not something you really want to hear.
Yeah, like you're twisting his arm.
It's twisting his arm, and also like it's like, you know, it's like if you ask a pilot to go fly a plane, he's like, yeah, I think we can get that off the ground. I think we can land it. You don't really want to hear that, you know. I want that really cocky, arrogant pilot that's like, I know this. Get out of my face. I know what I'm doing. I can. This is easy. We can fly through the hailstorm, you know. Yeah,
no, I understand that for sure. So how'd you get there finally at 37?
So what had happened was, you know, I had had a dentist who she's relocated since then, had said, that bite you have, I really think you should talk to a surgeon at some point. And I think she had mentioned your name and mentioned someone else's name, but it was very informal, casual, and she never really followed up with it. But first you need to see an orthodontist, and I'm like, not talking to any more orthodontists.
Yeah, I've been through it.
I've been through it, and I heard, you know, there was just, I really wasn't trying to hear that. Yeah. Because I knew that it wasn't going to fix it. I knew I needed surgery. Everybody's told me I needed surgery, but everybody, you know, scared me about the surgery. You know, everybody would tell me how horrible the surgery was. Oh, you don't want to go through that. And a blessed memory, late memory, Rick Klein, of Smile, Texas, you know, he's passed away. He was a great guy. Yeah. And I met him through some friends, and, you know, it was on a personal level, he's like, you don't want to get orthognathic surgery. Did I say it right?
Yep. Okay. Orthognathic surgery.
But I think that's before everybody knows all the accomplishments and advances that you've made with the procedure. Yeah. I mean, so it was like, I think I'd seen an Instagram post, because I'm not, like, I would say maybe once or twice a year, I would just do a Google search for orthognathic surgery.
Yeah. Just kept the interest was there.
Just to see, because, you know, it's like, well, who does it? And I always felt like, well, I'm in Houston. There should be someone in Houston that should do it. You know, I mean, we have the best medical center.
Definitely.
Whatever SEO stuff would come up, you know, that would get to it was never really anything significant. And then I just started seeing your Instagram reels coming up. And so then I started watching. And so I was like, oh, this guy, does jaw surgery. He does jaw surgery. He wants to do jaw surgery. Because that's what you want. You want someone who's like, yeah, I want to do it. Like for me in my business, like I do crazy structural work. Like if you want to take out load-bearing walls or structures, like I'm your guy.
Yes.
Like that's what I like. I like the small, like the quick stuff that most sane people, that's what they want to do for their bread and butter. But I like the really challenging stuff.
Yeah.
And maybe this isn't challenging for you anymore.
Yeah.
But I like that, you know? So I was like, I want somebody
that wants to do this.
Yeah. That and has a passion for it. And it's like, oh yeah, okay, you've got a jaw problem, big deal. And so I think, you know, whoever was manager, I was like, well, what about my jaw? You know, can you fix my end-to-end bite? And it was like, yeah, come on. And I was like, you know, I'm scheduling an appointment.
Yeah.
And because my thing at that point was, what I felt was going to come from that appointment was the following, was that I never met with a surgeon before. And most of the times I've ever consulted with a surgeon about something, it's usually been, I mean, I get my name's defined by a knife. You know, of course I love doing surgery, but you don't, because like I have a colloid cyst in my right lateral ventricle in my brain, right? It's been in there for 20 some odd years, right? Hasn't grown. Surgeon says, if you want me to take it out, I'll take it, but do you really want to go get brain surgery? Let's just let it hang out there for a little while, right? You know what I mean? So I thought it was gonna be like, yeah, you have this condition, buddy, but you know, you just have a bite or whatever. And then we had our consult. And I learned that there was a lot more going on than it was a lot to take. It was a lot to take in.
Yeah, it's a lot of information.
Yeah, it was, but it made sense in a very quick period of time because it was almost a relief. But I'm not gonna lie, I came in a little skeptic. Yeah, because you know, as the coin of phrase is, you know, someone who lifts weights and stuff like, you know, bro science. You know, it's like, oh, if you drink all this protein, if you take this supplement, it's going to give you that. And you know, they're coming in and your nurse said, I think you have sleep apnea. And I'm like, oh, come on, sleep apnea. And then it's like, oh, well, you know, your nose is going to get better and all these other things are going to get better all at the same time. You're like, okay, come on. I just have a weird bite, guys. It's not that big a deal. And then you start realizing, and now to like, you know, to be, I feel like, be like a poster child for it where, you know, it's improved my aesthetic, it's improved my profile, it's improved my breathing and all these other things. You really see like it wasn't bro science. It's all real. Related.
Yeah. And then it makes a lot of sense, right? It's just
I almost feel stupid for not like automatically getting it right off the bat.
And you shouldn't, because most dentists and doctors are not.
Yeah, I mean it's
seeing it.
It's shocking though.
It is shocking
because it's literally made life so much better for me. And that's why I'm such a big advocate, such a proponent of it. And I'll always be the biggest champion for it because it was literally the dragon that could never be slayed.
Yeah. I like that.
It was.
Yeah.
It was a dragon that couldn't be slayed. And then it was like, oh yeah, we can do that. And then I'm like, okay, well, all right, doc, how long are you going to have me wired shut for? You're like, I'm not going to wire you shut. What? You're on a no chew diet for 8 weeks. And I was like, I don't know how I feel about that. Yep. But I mean, that really wasn't that bad. And we can get to that whenever. But I mean, that was the initial thing. And I just remember, but I knew the thing that put me most at peace with everything was that I knew you knew how to do the surgery. I saw your confidence and you were very matter of fact about it. You had a great bedside manner and all that stuff. But to me, because sometimes you'll go to some doctors and they're trying to sell you right off the bat. Yeah. You know, they look, everybody needs to make money. Everybody needs to make a living. And I have no problems with that. Sometimes they tend to oversell procedures. And you're like, okay, are you looking out for me or whatever? And I looked at you because the way you said something was like, this guy doesn't, I'm not going to make or break this guy if he doesn't get the surgery. I got that feeling.
That's awesome. You can read people.
Yeah, you know what I mean? Because I mean, I remember an ex of mine had gone for a consult for some wisdom teeth. And I was like a month or two post-op and she couldn't come here or whatever. I don't remember the case when she couldn't, but I remember they said to me, oh, well, we do those here in our office. Talking about doing my surgery, the surgery you did on me.
In the office setting.
Yeah. And I was like, oh yeah, we do those all the time. I was like, no, you don't.
Right.
No, you don't.
Yeah.
No, you don't. You don't. That's cute. That's sweet, but no, you don't.
Right. I don't know why this is, but every dental website, every dentist, if you go through a website, it'll list procedures and every procedure is on that. And then same with oral surgery. You go to any oral surgery website and you go to procedures and orthognathic surgery is on that. But we know that most practices
will never
do a case.
I mean, it's like I told you around the first of the year, I had to get my cornea scraped because I had a corneal injury, right? And the eye doctor, she was awesome. She's a cornea specialist, right? It's like, do I need to see you anymore? She's like, no, go to someone for your, like, you want someone. And I feel like, look, we're very spoiled because we're in Houston. So there's literally a specialist for every single little thing that you don't have to have a generalist.
Take that for granted.
You know,
it's here.
You know, it's like I always joke about Houston. It's like, you know, someone says I broke my arm, what part of your arm? Because that's going to determine what doctor is versus if you live somewhere else. It's like, well, that doctor could be doing. I mean, it's like, do you need spine surgery from this doctor? Whatever, you know. Some of these doctors only do ACLs, and they've never done spine surgery in years. It's so specialized.
It is so specialized. It's true.
So again, I'm a little spoiled, but that's what I'm used to, and I feel like you do get the best of the best here.
Yep.
But which I did. You are the best of the best at that. But I mean, I just remember when you told me that. What you had told me was like, I can't do anything for you until you get your orthodontic. You need to see an orthodontist. And I was like, okay, you refer me to an orthodontist who was fantastic. He was awesome. He hung in there with me, very confident, understood how to do surgery. And he wasn't selling me. Because what I loved about him was he looked at my x-rays that you had sent over, the CAT scan, whatever it may be.
Yep.
And he goes, I can't fix that. He laughed. And I was like,
who was this?
Dr. Devuti.
Devuti.
Yeah, Devuti looked at it, he goes, I can't fix that. I was like, I like this guy.
He's a very transparent, honest person that has a ton of experience.
He's phenomenal. He's got but he's very straight to the point. He's very quick. He gets it going, but that's fine. He's got a great staff that supports him. Yep. He's no BS. But that's what I loved about him. And, and I felt like you two were, because like there was a question about how they're going to, he called you on your cell phone.
Right.
And you guys figured out that, and I was like, okay, you know, and I'll never forget, it's one of those moments, you know, when you're a kid, you know, it kind of brought me back to some childhood memories. You know, when you're a kid and you have to get your braces off or whatever, you can kind of look at your mom and be like, all right, Mom. She's like, oh, well, you know, we'll wait till next time. We'll talk about it and we'll bring him back another. But I was like, it's like, well, do you want to do it? And I was like, oh, I'm by myself. You know, so right on spot, you know, I was like, yeah, we're going to do this. And he took that permanent retainer off. We took the impressions for the Invisalign. I was like, we're going through with this. We're going to do this. And that was the beginning of what was a awesome journey, and it's been a phenomenal result.
Yeah, I love hearing that. How long did that process of braces before or Invisalign before surgery take for you?
So you and I had our first consult in January of 2023. Yeah. So January 2023, and then we did the surgery on November 28th, 2023. So it was the longest part, honestly, was waiting on, well, I mean, the aligners went pretty well.
So probably 6 to 9 months in aligners.
Yeah, I was in aligners from March up until October.
Yeah.
And then we were in a holding phase, and then he made those retainers, and then we went and we got to business.
It's pretty efficient process. So then we go to surgery. What were your expectations and anxieties going into it?
You know, I had a lot. I will say, I felt like compared to most patients, I had a lot of time to mentally prepare for this.
Yeah. Because
this to me was something that was never going to happen. I never really, so a lot of it was just kind of pinching myself to wonder if this was really happening. And I remember being in the pre-op space, I was being a little ornery because I didn't want to go without underwear in the surgery.
Yeah.
But
our patients can keep their underwear on.
Yes.
We're not putting Foley's in for
sorry, people. I'm not trying to scare y'all. Yeah. They didn't put a Foley in me. It was fine. But sorry. But
that is standard.
It is standard. Yeah. Yeah. I learned that. But then they were like, no, leave him alone. You said that. It was, But no, sorry. Don't be scared of me. I was just being a brat that day. I was hungry. It just didn't seem real. It was I was like, I can't believe this is actually happening.
Yeah.
And and look, I mean, I'm not just saying this because I'm trying to blow smoke up your ass because we're sitting here or whatever, but I was confident in you. I was like,
I appreciate that.
He's not going to let anything happen to me.
Yep.
I was like, he's not going to mess this up. I had 100% confidence in you.
Yeah.
Like I had hair transplants right before we had surgery. I was more nervous about the hair transplants.
Really well too.
Yeah, thank you. Right. I was more nervous about that than I was this. Yeah. For me, I think the biggest thing I was afraid of was the no chew diet because I've always kind of, I got a little body dysmorphia because I was always a real skinny guy.
Yeah.
So I was afraid of losing a bunch of weight, which I didn't.
Yeah.
I just think it was like I knew it was going to happen. I was just ready to do it.
Yeah.
And I remember waking up post-operatively. We actually had a little bit of
we had a complication.
We had a complication.
Yeah.
And I'll let you talk more. I mean, you can talk about it. I don't care if you want to tell everybody what happened.
When you went to the recovery room, I remember getting a call from the nurses that you started to swell up. So you had a hematoma, which means a little blood vessels started to open up in your cheek after surgery. So we took you back in.
Was it crazy in there when you opened it up?
No, just a small little vessel that we needed to buzz and stop, and then.
So you had to undo the sutures and everything that you had done, everything?
Yeah, we had to undo that.
Was that frustrating having to redo that?
Find their little blood vessel that was oozing, close it, and then close everything back up. It's not frustrating.
It's part of the job.
Yeah, it's part of the job. Thankfully, those are very rare. And then thankfully, we found it fast, controlled it, got you right back into the recovery room.
You know what's interesting about that?
You probably don't remember much of that.
Actually, I do remember a lot.
You do?
I do remember a lot of it. And I'll tell you what my memories were of it. So for those of y'all who see Dr. ALFI, when you consult with him, when you visit him, you see him on the podcast, he's always smiling. He's always very jovial. He's always a very happy guy. And you even ask, and I remember even asking, because my sister's a surgeon. I have younger twin sisters. One's a nurse anesthetist.
Michelle?
Michelle's a nurse anesthetist. And then Rachel's a surgeon in Tennessee. Yep. And so I've heard a lot about surgeons. I'm sure you know what it is.
Right.
But everybody from pre-op triage to post-op to anesthesiologists, CRNAs, everybody had great things to say about you. Everybody said you were super kind. You never yelled. You weren't an egoist. You don't throw instruments at people in the OR. I mean, that happens. Like I've heard stories about
many surgeons do.
They throw instruments at their first assists or their nurses or whatever like that, and no one had anything like to say about that. And you can always tell when people are holding things back. I feel like I'm a pretty good way of reading people, and especially feeling as close to people of all nations. No one ever said that about him. Everybody had really good things to say. And even the woman doing my triage said that she was trying to get her insurance qualified to get her. She was jealous that I was getting the surgery done that day by you. You know, when I will tell people, when you get the surgery done, you need to get used to this position, because everybody just sticks their fingers in your mouth and looks in there whenever. You'll be sleeping in the hospital and just people will just start doing this. You know, even the janitor, just kidding. But you know, that's the common thing. They look in your mouth while you're in the hospital or whatever. It's just part of it. And you're like, oh yeah, sure, take a look. When I saw you, I was like, okay, he's not going to let anything happen to me. Like, it's just, shit's not going to happen to me because he's here.
Yep.
And I think I did they did a chest x-ray on me. And then I remember Gabe, who was the nurse anesthetist.
Good memory.
I have a really good memory.
Yeah. Under influence.
I'm telling you, man, I have a ridiculously good memory.
Yeah.
But Gabe was like, hey, Aaron, unfortunately, we're going to take you back under. We're going to have to put the thing back up your nose and everything like that.
Yep.
And then I went back in, and then I woke up, and then
back to normal.
Everybody was happy. Michelle was there.
Was she really?
Michelle was there. Because remember, if you remember, they had hauled me off. Yeah. And you were like, wait, where did you go with my patient?
I do remember that. Because
you had to boomerang me.
I wanted to take a look before they sent you to the floor.
But that makes me happy, because the porter was like ready to get off work.
Yep.
Who took me, and he just like took me off, and you're like, whoa, wait, hold on. Bring my patient back. You weren't mad. You didn't yell. Like I was saying, he didn't yell. He didn't get mad, but he was like, hold on. No, my patient, I want to see my patient. And he's had a complication. I want to see him before he goes.
Right.
And I remember Michelle was with you, and you're like, okay, you did the look. And then it was like, okay, now he can go back to his room.
Yeah.
And the rest was there.
That's great. What was that first couple weeks of recovery like?
You know, like, it wasn't bad. I mean, like I said, I had a lot of time to mentally prepare for it. So I knew that, like, I was going to have to just take it easy and chill. And I was going to have to be and you do need somebody who's going to be by your side to be your support. Fortunately, my mom was who looked after me.
Yeah.
But
I remember she was very supportive.
You know, but I mean, it was, you know, I was in the hospital, came out, then I went home. We figured out the food situation really quickly. And that's what gave me a lot of peace really quick and made me able to recover. But I mean, you know, look, we were supposed to take it easy the first couple of weeks, and I wasn't listing anything. But I mean, when I was in the hospital, I got out on a Friday, and I had to do payroll, and I had my mom take me straight because she was driving me. I had her take me straight to the office. I ran payroll, and then
went straight to work.
I went straight to work.
Wow.
With my head wrap on. So I had just gotten out, and I was like, hey, I need to run payroll. Can you take me by the office real quick? So I went to the office. I did payroll. And then I was like, and then everybody was like, and then I started asking some questions and everyone was like, go home, go home. So I went home and I laid down. I remember the second day I was home, you had said you didn't want me laying around. And I was like, well, I have one of those Tempur-Pedic beds, but I was like, no. So I sat in a chair.
Yep.
And then I went down and took the dogs out. I wasn't holding the leashes. And I just kind of did that. And then the next week I was going to work for half days.
It's impressive. So you really didn't slow down.
For me, I was slow.
Yeah.
I was in turtle mode. Mm-hmm. But I was working half days for a little while. And I mean, it took me about maybe 2 or 3 weeks before I felt like I could drive again. Just because I felt just so full.
Heavy, yeah.
Yeah, I mean, I can show those post-op pics if anyone wants to see those sometimes.
Yeah.
But yeah, I was never...
Was it pain or what were you feeling?
No, I was never pain. It was just your face just feels, you're numb.
Yeah.
And I remember you had told me that, but until you experience it, you don't really know what that's like. So I felt, and it's a blessing really to be that numb because you don't really feel...
It is a blessing in disguise.
Yeah, it really is.
It blunts all the pain in the early post-op period.
But it's really important to take the pain medication.
Yeah.
I do the pain protocol.
Stay on top of it.
I mean, I didn't really feel any pain. I mean, you stay on the pain protocol like you should. We never did Norco on mine. I thought about asking for it, but I mean, we just did the Tylenol 3s with the ibuprofen and that worked fine.
Yeah.
I just don't really ever remember a time being like, oh my gosh, I'm in excruciating pain.
Yeah.
I was just numb and I was more concerned about not chewing, and I didn't chew.
Yeah.
But that was really
you were very compliant. I remember that.
Well,
I don't know about the working out. You worked out pretty early.
I was back in the gym. So, I mean, I'd say I was back in the gym in January.
Okay.
But I mean, even then you told me nothing excruciating, no jumping, no running or anything like that. So my thing was I was sticking with machines and cables only.
Yeah.
Was kind of my safety net that I was using. Yeah. Just to kind of get the muscles active, do something or whatever. And then, because I had plenty of time to get back. But my thing was I knew I was eating and I didn't really lose. I lost 3 pounds and then gained 4 back.
That's great.
While I was on the no chew. Actually, the thing that I found was I lost more weight going from no chew to soft chew.
Interesting.
Because it's the adjustment
probably takes longer to eat.
Yeah, well, because you're not confident in yourself.
Yeah.
You're like, ooh, is this
right?
Whatever. And so, but I'd say by the tail end of soft chew, you're ready to go to full.
Yeah.
But I mean, I still would avoid crunchy stuff for a while. I wouldn't rush to be eating peanuts or anything like that. But I mean, that was kind of, and when I say there was a weight loss, it was maybe like a pound or 2.
Yeah, that's great.
But I mean,
Are you back to 100% normal chewing now?
Oh yeah.
Beef jerky.
I've never been a beef jerky guy, but I mean,
you could.
I could. Oh, for sure, I could if I would. I mean, there's nothing I don't feel like I can't eat. I eat peanuts, crackers, all that stuff all the time. I mean, there's no restrictions whatsoever on my diet.
That's awesome.
At all. No, not at all.
That's awesome. Are you still numb?
A little bit.
Where?
It's not. I just had this tingly sensation right here in my chin.
Yeah. So you can feel yourself touching.
I can feel myself. I can feel it. It just has a different sensation.
Just a little different. Yeah. Does it bother you at all?
No.
Yeah.
I could have it bother me if I wanted to, but then the trade-off that I've gotten for all the improvements it's made to my life, it's just not that big a deal.
Yeah. That's what I hear a lot. I mean, most people will regain it completely in about a year. Sometimes it could take a little longer. Yeah. It could take even 5 years for it to completely come back. But most people say that it's more trivial than anything.
I would agree with that. It's more trivial than anything. I mean, I'm not in any pain. I'm not in any discomfort. I mean, the only time it could be problematic, I will say for guys, the only thing that's a little bit you should be wary of when you first, come out of this is just shaving after you have the jaw surgery and trying to shave around here, because you don't feel it the same way you do, but you get used to it.
Yeah. How about breathing? When did you notice it right away when you woke up?
Yeah. Instantaneously.
Instantly.
Yeah. I could breathe out of my nose.
Yeah.
Well, I'd say actually maybe 2 days. Because I had a little bit of a runny nose coming out of surgery. Yeah. You beat me up pretty good.
Yeah. Usually, you had 2 intubations. I was within a couple hours.
I was beat up pretty good.
Yeah.
But I mean, I wasn't. Like I said, I wasn't in pain. I was just like, oh, my head's heavy. That was
right. Usually, what I'll hear is right when patients wake up, they're like, I can breathe better than I ever did. And then
for sure.
And then the congestion and swelling comes, and then it goes away for a little bit, and it comes back once the swelling goes down.
The contrast here is that, when you have a deviated septum correction like I had two of them with turbinates done at the same time.
Mm-hmm.
When they pull the splints or they pull the packing or whatever, you're like, oh my gosh, this is amazing, right?
Yeah.
But about 3 weeks later, reality sets in. The turbinates get inflamed again and everything kind of swells all up or whatever. I feel the same as I whenever had packing unpulled. And that's today.
Yeah.
And I'm getting over a little bit of a cold that I've had.
And doesn't hit the same.
Doesn't hit the same. One of the reasons I was very pushy to get the surgery date that y'all got me. Again, that was the thing that was so cool is that I'm really involved with the Houston Livestock Show and Rodeo.
Yes.
And you guys knew that, and you made it a priority to get me on the surgery schedule so I could fulfill my obligations to the rodeo.
Yeah, I remember that.
And that was, y'all were really generous about making sure that I got on the schedule. Your office did not have to do that for me. You didn't have to do that for me, and you did. And I'm forever appreciative of that.
I know the staff that took you up on the invitation to the cook-off was really happy.
Yeah, I was happy to have
about that.
We didn't sponsor a tent this year, crazy, but I have a lot more responsibilities now on my committee. I'm on the operations committee. But that said, I wanted to be able to eat barbecue at cook-off. I was able to do that. I was able to fully.
It's awesome.
I had a great time, and I don't know. It was it just went so smoothly. It was. But I was able to fulfill and do everything I needed to do for my committee within that time period, and that's involved lifting and moving stuff.
Yeah. What did it feel like looking in the mirror and seeing a different face, or was that the case?
So there's a picture in my phone. This is a great segue. Mm-hmm. I didn't even prime you up for this.
No.
This is a great segue because I'll never forget there was a time I was working on my rodeo shift and I took a selfie with me and my crew and I looked at my face and I go, holy shit, what did I do to myself? I look so different. And then I kind of started looking at it and then I started looking, I was like, because again, to me, I didn't think I was going to have any kind of aesthetic change, but then I started looking at as the swelling went down, I was like, oh my gosh, I look so much better.
Yeah.
And then I started getting all these compliments and then people would be like, Aaron, you look different, but you look good. And even my girlfriend now is like, I'm glad you got that surgery.
Yeah.
Because I don't know, there's a lot of women like, it looks like your evil twin brother before, is what I've been told.
Yeah. Yeah, that's great. Are we ready to show his before and after? Another 5 minutes. You gotta keep watching.
But that was the thing that was so wild to me. It was the angle I had taken in that selfie. Well, I'll send that to Michelle. She could post it. It's not a flattering angle. If you're looking at it right now, not a good angle. Terrible angle. But it was the first time I was like, oh my gosh, I look a little different. Mm-hmm. But then if you look at pictures of me, contrast to how I looked before and after now, again, I did not think there was going to be any cosmetic benefit to this. And I emphasize on the word cosmetic benefit because you could say cosmetic change, but I would say cosmetic benefit because your face is more proportional. It's symmetrical. Balanced. And it just kind of, it's far more balanced than it was before. Yeah. And I feel stupid. I didn't realize that was going to happen, but it's been life-changing for the best. Yeah. Life improving, should I say.
Yeah. That's awesome. Do you notice a difference? I know you work out a lot. You do some bodybuilding. Do you notice a difference in mass accumulation?
So the mass, putting on mass, you talk about trying to put on mass in your late 30s.
Yeah.
I'm knocking on 40's door. That it's going to be really hard and really challenging to put on. I don't feel that problem per se. I don't feel like, oh, my age is in the way of anything. I get a little more achy or whatever, but I don't feel like there's any problems with, my endurance is far better than I can breathe. Trying to do cardio before, I built a gym for some guys here in Houston. They trained a bunch of Texans players, NFL players. Well, a lot of NFL players. I shouldn't limit to the Texans and even NBA players. And I would do their routines, and they'd always say, when you first started, we were kind of laugh how you'd be sucking wind and having a hard time keeping up. But you've been with it for a long time. We never understood why you couldn't keep up with it, and seeing how it is now for me to work out, where I actually have a really good airway. It's not just Aaron's asthmatic. That's why he's having a problem. We're like I told you before, we started filming today. We're in green tree pollen season. That's like, if you want to kill me, anybody, just pour green tree pollen on me and I'm going to wither away.
Yeah. So for those of you who don't know, pollen in Houston around this time, it's crazy.
It's brutal.
Yeah, we have neon green cars.
It is
all over the streets.
I mean, literally last week I got some on my arm and I had this huge hive. I had to go take a shower right away, and it lasted for about 2 days. But I mean, compared with previous years, I would be so congested. I would be having to take nebulizer treatments every 4 hours for my asthma because it would get in my lungs and everything like that. And it was awful. And I mean, again, I haven't really had to use any type of allergy medication this entire season.
That's crazy.
It is insane.
This is really interesting to me. So you were an asthmatic.
I mean, technically I still am, but yes.
Yeah. So, but you've noticed a complete difference in symptoms and need for nebulizer treatment, or are you using anything?
For sure. I've noticed a far less need for using the neb, because I mean, for the longest time, if I had any type of asthma attack or any type of asthmatic issue, the only thing that could really shake it was a nebulizer.
Yeah.
I always had to go nebulizer, which people who don't have asthma, it's pretty much the nuclear option.
Yep.
To take care of it.
Yeah.
Because there's a lot of times, I mean, because I was actually one of the very first COVID cases in Harris County. We go back all the way back to 2020. Oh, I have to bleep that out because you can't say that on the channel.
You can say.
But I just remember when I was in the hospital, like, well, we think we can stabilize you with inhalers, and they couldn't. And I mean, I didn't have to go on a vent, but like so they had to put me on neb because they didn't want to have the aerosol out there to get. They wanted to reduce the contaminants.
That was a wild time.
That was a fun time, right?
Yeah.
It sucked. Nowadays, I'm able to use a inhaler to subside that. I mean, sometimes, but I mean, I think that's just anybody with an asthmatic, but I would say that my asthma is a lot better controlled as a result of taking as a result of having the surgery.
That's awesome.
Yeah. And it is definitely awesome. Yeah.
That is awesome. Better lung health too.
Yeah. Right now, again, it's not a very good test of it because I'm getting over a cold. But I mean, again, my colds last longer. I'm not getting sinus infections as quickly as I used to. I don't think I've even had a sinus infection since I've had the surgery.
Since you've had surgery. Mm-hmm. Yeah.
No,
I mean, it's just so much healthier.
Yeah. I mean, but again, and it's just somebody who's had 2 deviated septum surgeries preoperative. I mean, I would get sinus infections a lot more often.
Yeah.
So
it almost sounds too good to be true, right?
Well, it does. I mean, and that's the hard thing about it is that, like I said, when I first met you, it was like, is this bro science? Is all that? But it really does make a huge difference because there's so much connected here.
Yeah. It's a gateway.
So
gateway to breath, and breath is number one thing in health. It's the priority.
Especially for somebody with asthma, because I will say when you have asthma like I do, you're used to not being able to breathe.
Yeah.
So when you ask me as a patient, you ask a patient who's accustomed to having asthma, well, can you breathe or how's your breathing? Well, if you use a peak flow meter, what is good for us is not so great for people without asthma.
Yeah.
So it's always kind of hard. I feel like probably in your position to ask somebody like myself before I had this surgery, how's your breathing?
Yeah.
Because we're used to substandard.
Right. Do you see a pulmonologist or primary doctor who's
primary
managing?
Care. My primary care physician.
Yeah. Are they aware of this change, or what are their thoughts on it?
Everybody's blown away by it.
Yeah.
I mean, everybody's blown away by it, and it's interesting because even my urologist, goes, it's interesting. Everybody finds it really interesting to see how big of a difference.
They have no exposure to this. It's not a part of mainstream medicine still. But the impact, like what you're saying, to treat autoimmune conditions, asthma, sleep, cognition, it really hits every part of medicine. But most practitioners, most doctors have zero awareness. Well,
yeah, and I think they don't have any awareness of it, and they don't want to admit sometimes that it's all connected, because I think people also some people are like, oh, I don't want to get surgery, but for the inconvenience of less than an hour to have the surgery, and then a couple, maybe 8 weeks of your life to be on a no-chew diet to feel just better. I mean, or feel great. I mean, comparatively how I used to be, it's I'm just on 2 opposite scales, and I didn't expect for it to be.
Yeah, that's awesome.
That exceptional.
What would your advice be to people that are on the fence about getting surgery?
Do it. I mean, my advice would be to but look, you have to mentally prepare yourself. So what I'm going to say to anybody out there that's on the fence about getting the surgery, or if you're going to do the surgery, here's just some tips. Okay. One, listen to your doctor. Okay. Yeah. And I'm not just saying that because he's standing here or whatever, but when your doctor tells you something, these aren't suggestions. They aren't like recommendations. That's what you need to do. You need to follow the rules. They're not trying to control you. They're not trying to just cover themselves or whatever like that. You need to listen to your doctor. This is not a game you're having. Mm-hmm. This isn't just a minor surgery. It's a surgery. Okay. So take it seriously. And I'm not trying to be like overly dramatic or whatever, but I mean that, like, listen to Dr. ALFI, listen to his office. Because, I mean, one thing that meant a lot to me, too, was when one of your nurses came and saw me. Yeah. Just to check on me. And you obviously came and checked, but I mean, they do care and they will be there for you. But you have to do your part. Don't chew, follow the rules, take your medicine. Just prepare yourself. Your mindset on this is going to be a lot of it. If you can just tell yourself, look, I'm going to be inconvenienced for this short period of my life, but I'm going to get through it. I'm going to be okay. It's not going to be the end of me. I will get through this. It's not going to kill me. I'll be okay. Like, it may be a little uncomfortable for this period of time. If you could just tell yourself and look at what the finish line is going to be at, you're going to have a great result, and you'll probably be wanting to sit in this chair too, like I am. But you have to just really mentally prepare yourself and have the right mindset going into it. That's the biggest thing.
I actually think that's great advice. Because, we do have a lot of patients that will chew early, and thankfully most of them do okay, but sometimes it'll cause problems with healing. And I think there is that component of, you're right, trust the process, right? Trust the team. It's very true. Everyone here really does care. Yeah. And not just here, I think doctors in general, they really do care. And I think that because of media or because of the way things are presented sometimes, there is a disconnect where...
There's a huge disconnect. They think, there's this whole perception that you guys are out here trying to control us and trying to keep us sick or whatever like that. Like, if Dr. ALFI wanted to keep me sick, he wouldn't have done the surgery on me. Yeah. I'm going to tell you right now, if the medical industry wanted to... If you wanted to follow that mantra, then he wouldn't have done the surgery, and I would have gone in braces or whatever it was, and I would be like,
keep putting a Band-Aid on it.
We keep putting a Band-Aid on it. Exactly. Yeah. So that's the whole thing. And I will say that your staff does know, like, if I say, hey, I'm feeling this sensation, they already know what I'm going through.
Yeah. This is what we do. I do over 200 of these a year. It's the only surgery I do now. And the staff is also taking care of 200 plus patients. Right. Per year. The nurses in the hospital, the anesthesiologists, this is everyone has the experience. You probably got a lot of that awareness from your sister then, right? Having a surgeon in the family.
Yeah, I would say I've heard horror stories with my sisters about patients not following their preoperative and postoperative instructions or whatever like that. There's not some conspiracy to...
It's interesting because it's like, I have two brothers. I never had a sister. Mm-hmm. But for, my son has two sisters, and I can see that he understands the opposite sex from a view inside the home. Right. Which was, for me, a big mystery. Still is a mystery. Uh-huh. Still trying to understand. But I feel like it would have been very helpful to have sisters growing up and demystify.
They're definitely a blessing, but they still don't. It's having sisters still doesn't answer the question.
No, it doesn't. It doesn't. But maybe some demystify a little bit. But I think having a surgeon in the family maybe is an analogy for that.
Yeah, it definitely did.
All right, we'll wrap this up. You guys have any questions for Aaron? He's very generous. Put them in the comments. We'll both be looking at this. Aaron, you're a valued member of the AOS family.
Hey, man, I'm honored to be part of the family, man.
All the time. For sure. I really appreciate you coming here.
Yeah, for sure.
Greatest basketball player of all time, in your opinion?
Oh, man. Greatest basketball player. That's got to be Jordan. I'm a Jordan guy.
I can't argue against that. All right. Subscribe, share, like, and we'll see you next time.
Thanks, guys.